If someone you love has been diagnosed with mesothelioma, you're probably feeling overwhelmed, scared, and uncertain about what to do or how to help. Being a caregiver for someone with mesothelioma is one of the hardest roles you'll ever take on, but it's also one of the most important. I'm Terri Oppenheimer. I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade. I've spoken with countless caregivers navigating the difficult journey you're on. Today, I want to tell you what every mesothelioma caregiver needs to know, from practical medical information to emotional support strategies to taking care of yourself so you can take care of your loved one. Let's start with what you need to know about the disease itself. Mesothelioma is an aggressive cancer, but it is not a death sentence the moment someone is diagnosed. Treatment options have improved significantly in recent years, and many patients are living years longer than would have been expected even a decade ago. Your role as a caregiver, it can make a real difference in your loved one's outcomes, outlook, and quality of life. First, understand that mesothelioma treatment is complex and requires the care of specialists, not a general practitioner. Your loved one should be evaluated at a cancer center that has experience in treating mesothelioma, not just a community hospital. As a caregiver, one of the most important things you can do early on is help research treatment centers, make appointments, and advocate for getting your loved one to specialists who see mesothelioma regularly. You'll need to get organized pretty quickly. Create a system for managing medical information, appointments, test results, medication schedules, and doctor's instructions. Many caregivers have found it helpful to keep a binder or use a smartphone app to track all of this. Bring the information you've collected to every medical appointment so you have all the details at hand. And at medical appointments, remember how important it is for you to be a second set of ears. When someone receives serious medical information, stress and anxiety can make it hard to absorb everything the doctor says. Take notes during appointments. Don't be afraid to ask doctors to repeat information or explain things in simpler terms. Ask for written instructions whenever possible, and after appointments, review your notes with your loved one to make sure you both understand the key points. If you have questions, call the doctor's office back and ask for clarification. Now, I want to take a quick break here and say, if you are finding this information helpful, someone else will too. Hit the like and subscribe buttons below to help others see our videos. It really helps. And if you have any questions or topics you'd like me to address in a future video, put it in the comment section. Finally, keep watching until the end of the video, where I'll give you valuable information about accessing important resources. Now, here are some important tips to help you as you navigate your caregiving role. One of the most helpful things you can do is to make sure you understand the treatment plan and side effects before they start. Whether your loved one is receiving chemotherapy, immunotherapy, surgery, or a combination of all of them, learn what to expect. What are the common side effects? What symptoms require immediate medical attention versus what can wait until the next appointment? What can you do at home to manage side effects? The more you understand, the better you can help. Medication management is often a crucial caregiver role. Many mesothelioma patients take multiple medications, chemotherapy drugs, pain medications, anti-nausea medications, plus medications for other health conditions. Keep a current list of all prescription dosages and schedules. Set up a pill organizer if that helps, and keep a close watch for interactions or side effects. Cancer treatment, it can affect appetite, it can cause nausea, and it can change how things taste. So nutrition becomes especially important. Work with a nutritionist if possible to develop meal plans that provide adequate nutrition, even when appetite is poor. Small, frequent meals are often easier to manage than 3 large meals. Focus on high-protein, nutrient-dense foods. Help manage symptoms and side effects at home. This may include helping with breathing exercises if your loved one has shortness of breath, managing pain medication schedules, helping with positioning to reduce discomfort, dealing with nausea or digestive issues, and monitoring for signs of infection or complications that need immediate medical attention. Transportation. Going to appointments is a major practical need. Mesothelioma treatment often involves frequent appointments, sometimes multiple times per week during chemotherapy cycles. Your loved one, they may not be well enough to drive, especially on treatment days or when taking certain medications. Be prepared to provide transportation or coordinate with other family members or friends to ensure they can get to every appointment. Understand the legal and financial aspects. Many mesothelioma patients are eligible for legal compensation through lawsuits or asbestos trust fund claims. As a caregiver, you might help gather employment history information, contact attorneys, or organize documentation that's needed for legal claims. Don't put this off. Statutes of limitations are real, so acting quickly is important. For veterans with mesothelioma, help navigate the VA benefit system. This can be complicated, but veterans may be eligible for disability compensation, healthcare through the VA, and other benefits. Help your loved one file claims and follow up on the status of applications. Emotional support is just as important as practical care. Your loved one is dealing with fear, anger, grief, and uncertainty. Be present. Listen. Let them express their feelings without trying to fix everything or minimizing their concerns. Sometimes the most helpful thing you can do is to just sit quietly with them, but also recognize when professional help is needed. If your loved one is showing signs of depression or severe anxiety, encourage them to talk to their doctor. Many cancer centers have social workers, counselors, and psychiatrists, all of whom specialize in helping cancer patients. Manage visitors and social contact in general. Some patients want lots of visitors and support from friends in the community, while others prefer privacy and quiet. Follow your loved one's lead on this. It's okay to politely decline well-meaning visitors if they're not up for company. It's also to ask friends and family to help in specific ways rather than just nodding when they ask you to let them know if you need anything. People really do want to help. Now, here's the part most caregivers neglect: taking care of yourself. You cannot pour from an empty cup. If you burn out, you can't help your loved one. This isn't selfish, it's essential. So accept help from others. When people offer, give them specific tasks. Bring a meal. Stay with your loved one while you're running errands or taking a shower. Do a load of laundry. Mow the lawn. Don't try to do everything yourself. Make sure you take breaks. You need time away from caregiving to recharge. Maybe it's an hour to exercise or going and getting coffee with a friend or taking a weekend away if other people can fill in on your caregiving duties. Don't feel guilty about taking breaks. It makes you a better caregiver. So maintain your own health, go to your own doctor appointments, take your medications, eat properly, and get sleep when you can. Exercise. Even if it's just a short walk, you'll be amazed at how much better you'll feel and how much better care you'll be able to provide when you have energy. If you get sick or you're exhausted, you can't help anyone. Find support for yourself. Many cancer centers offer support groups for caregivers. Online communities exist for mesothelioma caregivers, and they provide both understanding and practical advice. Consider talking to a counselor yourself to process your own feelings about what you're going through. It's also really important to set boundaries. You're going to face pressure from well-meaning family members who have opinions about treatment decisions or friends who don't understand why you can't maintain your previous social schedule. Your own expectations of what you should be able to handle can be a problem too. It's okay to say no, and it's okay to not be perfect. Prepare for difficult conversations. You and your loved one should discuss advance directives, healthcare power of attorney, and their end-of-life wishes. You have to talk about practical matters like finances and funeral preferences. These conversations are hard, but having them before crisis moments allows for thoughtful decisions to be made rather than rushed ones made under stress. Being a mesothelioma caregiver means managing medical information, coordinating care, providing physical and emotional support, handling practical and legal matters, and somehow taking care of yourself in the midst of it all. It's exhausting and it's overwhelming, but it's incredibly important work. Remember that you don't have to be perfect. You just have to show up, do your best, and ask for help when you need it. For caregiver resources and support information, visit mesothelioma.net or call 1-800-692-8608 or use the live chat feature on our website to speak directly to one of our patient advocates. As for me, post any questions you have in the comments section, and I'll see you next time.